understand the anatomy of breast. Your breast is basically designed to make milk. Let's get to know its various parts. It has Cooper's ligaments, which basically support the breast. So it's like this, it supports the breast. Then is the corpus mammae, which is like the whole body of the breast. Stroma. Stroma is the connective supportive tissues. For example, nerves and lymphatics and tissues are included in stroma. Then is the parenchyma, which includes the glandular tissue of the breast inside. Then are lobes. Lobes are basically a cluster of lobules, and lobules are a cluster of alveoli. Then lastly, we have ducts through which milk is being transferred towards the nipple. Now let's go into a bit of detail. So each breast contains 15 to 20 lobes. It contains branches of alveoli where milk is produced, and it contains milk ducts through which milk is being transferred from the alveoli to the nipple. Now this milk is excluded from the nipple through various openings over the nipple. There are nearly 7 to 9 openings over the nipple, which we call as pores. If we talk about alveoli, it is basically the terminal end of your glandular tissue where milk is being produced. It is hollow from inside so that the milk is stored. We have lobular arteries, which basically carry all the components of milk from the blood to the lobes, and we have the lobular vein, which carries blood away from the alveoli. Then we have the myoepithelial cells, which basically cover the alveoli in such a way that they create a web, or they are arranged in a skeletal fashion such that whenever the baby is sucking, with response to oxytocin, these cells contract and the milk is able to come out. So your size of breast does not determine how much milk you are going to produce. It's just that larger breasts have larger storage capacity and smaller breasts have small storage capacity. So it's a myth when people think that I have a small breast, so I won't be able to make enough amount of milk. There's nothing like that, because you have all the required components and your breast is already in preparation from your pubertal age. Now there are small pores over the nipple which become erect at the time of feeding, plus with response to fear or sexual touch, or with response to cold or heat. Now as we see the areola, there are nearly 15 to 20 small pumps that form. We call them as Montgomery glands. These are oil producing glands which help in lubrication, and also it helps the baby to be attracted towards the breast. How? Because they are producing slight oily like substance over the breasts, because of which the baby is able to smell a mother's breast and is attracted towards the mother's breast, and which makes the baby ready to breastfeed. These glands also help to reduce any infection. Now this is the reason why we suggest any mother not to wash her breast every time before feeding with the soapy water. Reason being, when we are washing the breast every time before the feed with the soapy water, it will remove the oil, because of which the baby will have difficulty to latch over the mother's breast. So there was a study in France wherein it was found that half of the mothers who were feeding their babies after washing their breast with the soapy water, and half the mothers were feeding without washing the breast with the soapy water. So the latch and the feedings were better with the mothers who were not washing their breast with soapy water every time before feeding. So this is the reason why we suggest not to wash the breast every time. Yes, definitely if it is too much of sweating is there, then you can just wipe it off, but there is no need to wash it with a soapy water.